Come in.
Hi, Miss Younger. My name is Carlisa. I'm going to be your nurse today.
Okay.
First thing I'm going to do is wash my hands. Okay, and we're going to start our assessment off by doing the hair, skin, and nails. The first thing is inspection, and I want to look at your skin overall. And I'm looking for color, any signs of cyanosis, any jaundice, any erythema. I'm also going to touch your skin, and I'm going to feel for moisture, and I'm going to look for any lesions, any cracks, rashes, anything like that. And your skin feels nice and warm, and it is dry. Also, I'm going to check your nails. And with the nails, we want the nail beds to be pink. There should be no peeling or pitting on the nails. Your nails look nice and healthy. They're clean and they're cut. Let me check your feet. And the nails on your feet are also healthy, nice and pink. Nails are cut and even and clean. Okay, next thing we're going to do is I'm going to look at your hair and check for distribution and make sure that it's nice and even. There are no spots, alopecia or anything like that. Everything looks good there. Now I'm going to don some gloves. And I'm going to palpate. I'm going to feel the skull, part the hair. So the first thing I'm going to do is I'm going to look at your head and make sure I don't see any tremors or tilting of your head, which I don't see. Now I'm going to palpate your skull, and your skull is a nice round skull, no lumps or bumps or lesions, and we call this normal cephalic. And that's what you want. Okay, so now I'm going to look at your face, and I'm going to check the symmetry of the face. I'm looking at your eyebrows, your eyes, your mouth, and your nose. Everything is symmetrical. There's no facial drooping. I see that you, of course, have eyelashes and eyebrows. The hair is nice and even there. Your nose is midline. So is your mouth. Once again, there's no drooping. I'm looking at the salivary glands, and I see no swelling. And I'm also looking at the base of the neck, and there's no swelling there either. Now I'm going to palpate. So here, I'm going to look at your ears. The ears look good. Also look behind the ears, because sometimes when patients are in the hospital, the oxygen can cause a pressure ulcer behind the ear. I'm going to palpate the maxillary sinuses. Does this hurt?
No.
Frontal?
Okay.
Okay. Keep your eyes closed. I'm going to palpate her orbital. Is that tender?
No.
Okay. Good. Now, I'm going to have you open and close your mouth. Let's see. Okay. And this is the temporomandibular joint. I was feeling to see if there was any popping or pain, and she said no. Now I'm going to get the pen light. I'm going to look at her nares. So here we go. And I'm checking for deviation, and there is none there. Everything's nice, good, little hair, that's normal. Okay, if you would open your mouth for me. And here I'm looking at the buccal mucosa, and also her teeth, which are nice and white, no cavities, no fillings. Stick out your tongue for me. This is cranial nerve 12. Say ah. The uvula rises in the back. Close your mouth for me. Her lips are nice and pink. I see no cracking, lesions, or anything like that. So now I am going to palpate her lymph nodes. First, we're going to start off with the preauricular, using the pads of my fingers. Postauricular, occipital, submental, submandibular, tonsillar, superficial cervical, postcervical, and posterior cervical, and then supraclavicular. Okay, so we have that. Now I'm going to stand behind her and palpate her thyroid. Okay, so I'm going to stand behind her, have my patient swallow for me. And I feel nothing there. If I did feel something there, it could possibly indicate hypothyroidism if it was enlarged. I'm going to check her trachea to make sure it's aligned, and it is. Everything looks good there. Now we're going to do the eye test. So we're going to start off. I'm going to cover her eye, give me a little darkness here, and I'm going to come in from the side and make sure that the pupil dilates, and it does. Constrict. I'm sorry. It does. I'm also going to check her. I'm going to pull her lower lid down and check the conductiva. It should be nice and pink, which it is. I'm going to lift her eyelids and look at the sclera, and it is nice and pearly white. Good. Okay, now I'm going to have you follow this. We're going to check the 6 cardinal fields of gaze. If you would follow this pen light. And with this, I am checking for conjugate movement. Okay, good. Now Now I want you to follow it. Okay, very good. Okay, I'll give you a second to recover from that. All right, so now I'm going to use the ophthalmoscope, and I'm going to check her optic disc. And the optic disc is going to appear kind of orangey red. You will look straight ahead for me. There we go. There we go. Okay, and I see it in that eye. Alrighty, and there. See it in that eye. Good. Okay. So now I'm going to have my client stand. We've already marked off 20 feet. If you would stand right here for me. And I'm going to walk to the eye chart. I'm going to have my client cover one of her eyes. And I'm going to have her read line 8 for me. Cover one eye, please. And read the line. D-E-F-P-O-T-E-C. Very good. Take a hand down, rest for a moment, and do the other eye. And here we go. D-E-F-P-O-T-E-C. Okay. This will indicate that my client has 20/20 vision. If you could, please have a seat back up on the table for me. Okay, and now we're going to do my client's ears. Once again, I'm going to look at her ears. Any problems with your hearing? No. Okay. There's no drainage or cerebrum in the ear. Okay. So first test we're going to do is the Weber test. All right, the Weber test. Okay, I'm going to place it center of her head, and she'll tell me if she hears the sound equally. Yes. Okay, very good. Next thing I'm going to do is strike the tuning fork and place it on the mastoid. And she'll tell me when she no longer hears the sound. Okay, good. I'm going to do it again on the other side. Place it on the mastoid. Okay, and of course, placing it in front of the ear is air conduction, and you will hear air conduction longer than the other. Okay, very good. Okay, so next I'm going to lay this down. The next thing we're going to do is lungs. So I'm just going to watch my client for a second, and I'm going to just look at her chest and make sure that her respirations are not labored. I'm going to note the rhythm, make sure they're nice and even, and I'm going to check her AP diameter, which looks fine. Are you having any difficulty breathing? No. Okay, everything looks fine. So now that I see my client, everything looks good, I am going to palpate. And the first thing I'm going to do is palpate in the back. And I'm going to start in the upper lobes. And here, I'm checking for crepitus. And this is common in patients with COPD or emphysema. And it will feel like Rice Krispies under the skin. This comes from air getting trapped in the subcutaneous tissue. So I'm going to palpate here. I feel nothing. I'm going to do the same thing in the front. I feel nothing. Okay. Now I'm going to check expansion. So I'm going to place my hands at the 10th rib and have my client take a deep breath in, and my hands will rise symmetrically. Good. Well, that's good, and that's a normal finding. Next thing I'm going to do is tactile firmness. I'm going to place the palm of my hands in each lobe and have my client say 99. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99. Okay, very good. I'm going to do the same thing on the front. I'm going to have my client repeat 99. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99. Okay. 99, 99. Okay, very good. Okay, so now what I'm going to do is I'm going to percuss down my patient's back. Okay. Okay, very good. Okay, now I'm going to check for the diaphragmatic excursion. So what I'm going to do is have my client take a deep breath and hold it. Take a deep breath and hold it. And now I'm going to percuss down her back until I hear an area of dullness. And when I hear that, I will mark here with a piece of tape or a pen. Okay, and I'm going to do the same thing on the other side. You can go ahead and breathe normally for me. So catch your breath. Okay, now hold it again. And I will percuss down her back. Okay, then I will mark there. Go ahead and breathe normally for me. Okay, this time I have my client exhale and hold, if you would. All right. Okay, go ahead and breathe normally for me. And I will do the same thing on the other side. Okay, exhale then hold for me. And I will measure this area, and normal is 3 to 5 centimeters. Okay, and my client is 4 centimeters, which is normal. That's very good. Now I'm going to auscultate the lungs, which is the most important thing with the lungs, of course. Want to hear a nice clear sound. And I'll just have my client take a breath in each lobe, if you would, in and out for me. And normally you would do this without a shirt, but since my client is nice and healthy, we're good. I can hear it just fine through the shirt. We're going to start from the front, same thing, in and out for me. In and out. Now we're going under the breast. Okay, and good, okay? Okay, the next thing we're going to do is CV. With CV, first thing, I always start with inspection. So I'm going to look at my client first, and I'm going to see, looking at her carotid and her jugular, and I see that there is no jugular vein distension. If I did see that, that would mean that my client possibly had congestive heart failure. Do you have any family history of heart problems?
No.
Okay. And also I'm going to look at her chest to see if I can see the heart beating, any movement of the chest rather, and I don't see any. First thing I'm going to do is palpate her arteries. First we have the temporal artery, the apical, the brachial, the ulnar, radius, femoral, and popliteal. There's not a whole lot of palpitation with CV. But what I am going to do is listen to her heart. First thing we're going to do is we're going to start by listening to the aortic valve, second intercostal space on the right, and you want to hear the lub-dub sound. Okay. Now we're going to go to the left and do the pulmonic. Third and fourth will be Ehr's point. Fourth, mitral. And fifth, tricuspid. Once again, we're going to hear a lub-dub sound. Now, one thing I did forget to do was the whisper test. So what I'm going to do is have my client put one finger in her ear, and I'm going to whisper something and have her repeat it.
ABC.
Okay, do it the other ear.
Okay. 1, 2, 3.
Okay, good. And that concludes my video assessment. Thank you.